Recording. All right. So welcome everyone. It's really glad to see many participants today. And this is our regular session on product knowledge. So today's topic is on antioxidants. So we have a very renowned naturopath, homeopath, ReneRoth. He has a 30+ years of experience with Modere Lipton tribe, and he has a great knowledge on both Western and traditional medicine. So he will be explaining some of the benefits of these products to all of us today. So Rene, if you are ready, you can get started.
Thank you so much for that intro, Betty. So a little bit more to the background as well, for those who may or may not know. I've been in practice 37 years now. I've been using the Modere products for the last 23.
Wow.
So I feel I've got a pretty good working knowledge of the products and have used these for many, many years in my practice. And I see some wonderful, wonderful results, whether they're as a standalone product or whether they're in combination with others. Some of these form part of a detox pack as well, and we'll touch on some of those things. But the two key things I want to bring across to you today is exploring both these products as individuals, but talking about antioxidants and talking about inflammation, because they're really, really key things. And everyone has perhaps heard of the word antioxidant, but what does it really mean? Inflammation, we'll look at how it perhaps forms the cornerstone of all chronic diseases. So let's talk about each product first, a little bit of an intro. We'll go into the detail of the ingredients, and that will hopefully give you an understanding of how it can really support your health and well-being, or the people that you come in contact with. So the two products we're talking about is the anti-inflammatory and the antioxidant, and the associated images there give you, it's pretty good ideas as to what those ingredients are. So we're going to explore anti-inflammatory first of all, and you can see from there that picture. And I think of what's really nice is that when you look at this, you can see celery, you can see parsley, you can see garlic, maybe the top one in the left-hand corner, you may not know, but it's actually devil's claw. That it's all about letting food be your medicine. So these are in a therapeutic dose, having a beneficial effect on our health and well-being. And they're actually things that are in nature, but in a concentrated dose to really support, in this regard, what's this product going to do? Well, it's an anti-inflammatory. It contains a blend of diuretic, herbal extracts, and kidney and bladder tonic. So a diuretic supports the elimination of fluid from your body. At the same time, it supports kidney tone and bladder tone. And these have been used traditionally for centuries to reduce swelling and provide relief from fluid retention. So just simply think, if someone's got, some swollen ankles or puffy fingers, we sometimes think, well, maybe there's something locally inflammatory going on there, or maybe their body's capacity to eliminate fluids, like the kidneys are a little bit sluggish, need a little bit of support. And we're talking about non-clinical conditions here. We're talking about just a bit of fluid, puffiness, swelling, perhaps on a hot day. The heat is aggravating the pooling and the gravity of the fluid in the leg. So this can be used quite effectively for that. We have to understand that there may be other severe clinical conditions like cardiac disease, which may be causing fluid. So it's often good to connect with your healthcare practitioner to determine what the underlying issues are. So this mix of traditional anti-inflammatories have been used for centuries. And so when we think of inflammation, we often think of aches and pain. So in terms of the arthritic types of conditions like mild arthritis, rheumatism, and gout. So these are things that we can probably in general say, but I'd like to drill down a little bit more as to what these particular preparation is capable of doing. Let's just grab that one there. So when we consider inflammation, so anything that has itis in, so whether it's like bursitis or tendinitis, the itis suggests inflammation. So inflammation from a visual perspective, what we call a sign, is often reflected by swelling, redness, heat, and edema means swelling as well. So that's a clear-cut sign that you have inflammation. Now, this preparation is very good in terms of supporting the immune system. So it's very effective in fighting bacterial or viral infections that cause inflammation, whether that's in the throat, a laryngitis, a pharyngitis, an otitis media, ear infection. So any of those sorts of infections, this preparation can be quite effective in helping. And by reducing the swelling which occurs at a local site, by supporting kidney function, your body will more effectively clear out the fluid that is residing in those areas of the body. And so let's have a look at this little picture. I'm going to go in more detail later, but and I think this probably bears repetition. So chronic inflammation can have an impact on neurological disorders, on cardiovascular disease, on mental health disorders, because I think this is something which is very less understood, that if you have inflammation in your knee joint, you have pain. You might have a torn meniscus, you might have a strained ligament, there might be cartilage erosion, and so you get some pain, and someone might need to have a knee replacement. But when that inflammation happens in your brain, it has often a physical effect which expresses as perhaps anxiety, depression, dementia, schizophrenia, Alzheimer's. So sometimes these mental, emotional conditions have an absolute physical origin behind them. You know, when someone's had trauma in their life, they've got concerns and they're carrying some issues and challenges around it that haven't perhaps effectively resolved. But sometimes mental health issues can have a physical origin. So we have to have an awareness that maybe by reducing some inflammation there, by supporting magnesium and essential fatty acids and so forth, would be really key in supporting mental health issues. Chronic inflammation, depending on what particular pathway, can contribute to cancers, chronic pain disorders, metabolic disorders such as fatty liver, heart disease, diabetes, metabolic syndrome, and obviously diabetic complications and any other chronic inflammatory disorder. So you're getting a little bit of a sense as to what this product actually may assist. And I'm saying will not assist, I'm saying may assist, because there are no guarantees in life, okay? Okay, so let's have a look at these ingredients individually. Now, number one, sorry, that's the first ingredient, and this is the order of their concentration. So, and it's not just the celery stalk, it's actually the celery seed, right? So there is a different effect from the celery and the celery seed. And so we know celery is rich in vitamins and minerals. It has very low glycemic index. So it actually, from eating the plant itself, because it's high in fiber, it gives you a slow rate of glucose uptake. It's rich in vitamins A, K, C, and the Bs, particularly folate, B6 and riboflavin. It's rich in minerals such as potassium, iron, manganese, magnesium, calcium, and it is low in sodium. So this is often said to be good for those with atherosclerosis or high blood pressure because of the low sodium content, because salt is sodium chloride. We don't want to give too much sodium into those people that have a blood pressure issue. As I mentioned, being rich in fiber, it has a low glycemic index, and so it can steady your blood sugar. It's considered as in the whole plant a superfood. You know, there are books now about celery juice, and I know people who go, you know, have their celery juice every day, whether as an individual item or whether in combination with other fruits and vegetables. We know about the anti-inflammatory properties of celery, particularly in the types of arthritis. So the osteoarthritis, the rheumatoid arthritis, and the gout. We know that it's bone strengthening because of the calcium content there as well. Cardiovascular support, so it can combat high blood pressure and cholesterol. Support weight loss, particularly in the individual who may be carrying a lot of fluid. So someone who's quite puffy around the legs or abdomen, maybe they're carrying a lot of fluid. So an anti-inflammatory in some weight loss protocols can be very effective. And it's rich in antioxidants. Now, they're the benefits of just celery. So let's now have a look at garlic. Again, another ingredient, which I'm sure you're all very familiar with. And so this is the bulb. And we know historically it's had significant history in terms of its medicinal properties, and why it's so effective because it has all these very rich sulfur compounds, including the allicin. And the allicin is said to be probably one of the key therapeutic alkaloids in this preparation. It has a very broad nutritional profile. And if any of you were to take a poll and say, name me your top 3 natural products to support health and well-being, I'm sure 90% of people would include garlic in that. And why? Because it has such a broad nutritional profile, and it's been used for many cultures as a therapeutic agent. Now, in terms of the minerals, it's rich in manganese, selenium, calcium, copper, potassium, phosphorus, and iron. Vitamin-wise, rich in A's and some B's there. And it's said with the folate there, it can help normalize homocysteine levels. So someone who has an elevated homocysteine level increases their risk of cardiovascular disease. So the folate can help keep those levels more normalized. Like the celery, it's high in fiber and low in calories. We know the benefits of immune function for garlic. So whether it's your general cold, and there's been significant studies showing that garlic can reduce the duration of a cold by 70% and also have quite a significant impact on the severity of symptoms. So if we can reduce the shortening and reduce the severity of a cold, obviously that's a good thing. Cardiovascular wise, we know it supports blood pressure to reduce that. It can reduce the bad cholesterol, so reduce the low density lipid cholesterol, and support heart disease. We know that there's been some studies where it can help reduce the plaque in atherosclerosis, so that's a really good thing. And a lot of these benefits are due to the very powerful antioxidant function. And so some of the benefits there from a cerebral perspective, reducing the risk of Alzheimer's disease and dementia. And it's said to be part of a strategy to promote longevity. So increase your lifespan in a healthy way. Some people use it to enhance their athletic performance. There's been some studies about its efficacy in detoxifying heavy metals in the body. That's a good thing because we're exposed to a lot of heavy metals in our environment. The cadmiums and leads and the arsenic, they're all there. So this helps neutralize that and helps your body eliminate it, and also supporting bone health. Okay, so we're going to parsley now. So third ingredient is parsley, petroleum. This is the parsley, your common parsley in your garden. It's the dried herb. And what about this product? So again, if you're using garlic and parsley and celery seed extract as part of your cooking, you're getting a similar benefit. But the great thing about this preparation is that you're getting specific amounts, because you don't know how long your parsley has been dried for. What you're getting in a tablet with Modere, you're getting guaranteed amounts of each active ingredient and the active alkaloids in them as well. But more on about parsley, it's antioxidant rich. So anything that's rich in antioxidant is going to scavenge free radicals. So we know that that's a key factor in cancer contribution. So it has a cancer fighting capacity. And there's been some studies showing parsley being breast cancer protective. That would be a good thing. Helping reduce the risk and development of Alzheimer's and Parkinson's disease. Supporting bone health because it does have some good mineral content like your calcium there. It can help deal with atherosclerosis. The immune system benefit is there as an antibacterial, and there'd be antiviral, anti-parasitic, and antifungal preparations benefits there too. It's a good anti-inflammatory, so we're seeing the joint inflammation in all our three ingredients so far. Parsley is a good digestive tonic. You can use this with salads, you can use it with many dishes that you cook with, and it helps reduce bloating, like the other two, very low in calories. Particularly rich in vitamin A, vitamin B, rich in vitamin C. So anything rich in vitamin C is going to support your collagen. So that's your connective tissue in your skin. Rich in vitamin E and K. Vitamin K supports your bone strength and also promotes blood clotting. So for those people who have bleeding issues, we need some vitamin K. So someone who's on a warfarin or any blood thinning or aspirin, they would need to seek their approval from their healthcare practitioner before going on this product because of the vitamin K. A bit like our green key, it does contain vitamin K. The minerals, particularly iron. So what we know there with the combination of iron and vitamin C, because we know for the absorption of iron into your system, you need the presence of vitamin C. So parsley is a wonderful synergistic natural combination of your iron and your vitamin C, also rich in potassium. Now, because of the deepness of the green, anything that is particularly green is very high in the pigment chlorophyll. And chlorophyll is known for its detoxification properties to leach out the toxins and chemicals, insecticides, pesticides, heavy metals, and so forth. And so that's really key. And it's helpful also in terms of diluting and eliminating some of these phytoestrogenic or phytoxenoestrogenic compounds from the body, which contribute to weight gain. So this is a nice product to get rid of some of the inflammation, to detox some of the chemicals that may have contributed to weight gain. And of course, it's the kidney and bladder tonic. So those who are prone to urinary tract infections, kidney and bladder stones, this as an individual ingredient, parsley is going to be helpful there, but also as the combination of all those ingredients, it's going to be great. And the fourth and final ingredient in our anti-inflammatory is devil's claw, and it's a plant. All right, so nothing special about this one. So Harpecophytum profundans, get your mouth around that one. So it's the tuber. It's native to the Kalahari Desert in southern Africa, and it gets its name from the tiny hooks that covers its fruit. So it looks like a little devil's claw, basically. And so this is well known to have very strong anti-inflammatory properties, and the active ingredient is the harpagoside. And so therefore we see the benefits in osteoarthritis, we see the benefits in rheumatoid arthritis, gout, joint pain. Getting a little bit of feedback there. Can everyone check that they're on mute, please? And also other rheumatic joint issues such as rheumatism or fibromyalgia. Fibromyalgia is a very misunderstood, debilitating condition, particularly a lot of pain through the shoulder girdle. People can't use their arms. You know, I had someone actually yesterday, a combination of fibromyalgia and fibromyalgia and chronic fatigue. You know, even just holding the phone for 5 minutes, exhausting. Going for a walk for 5 minutes, they take 2 days to recover, and a lot of shoulder pain. So a natural anti-inflammatory like this can help along with other products to support that type of condition. And devil's claw also has some digestive benefits there as well. Okay, so here's the first slide again, but what I've added up the top, have a look there. So yes, it's a standalone product. And like, for example, if you rely on, say, our immune health, which is a wonderful immune support from an acute level with all the things like the echinacea, rosemary, and hawthorn and Irish moss in there, if you happen to run out of that and you're treating a cough or cold or bronchitis or some infection, oh my goodness, I've run out of my immune health. This is a great product to step in to support the immune system. Because of the garlic, we know of the antibacterial properties there. So some of these products have multiple benefits. So typically we might use this for kidneys, bladder and inflammation. It's great for the joints, but also can be helpful for the immune system, particularly, say, if you run out of your colostrum or your immune health. So it fills a really nice gap there. So that gives you a little bit of perspective about our anti-inflammatory. But if you are on a more a comprehensive nutritional protocol, what I like to see everyone on, because our body does not manufacture minerals, it doesn't manufacture essential fatty acids, nor does it manufacture vitamins, I suggest everyone at least be on these 3 core products on a daily basis, because guaranteed you are not getting enough of these 3 core ingredients from your food in your diet today, all right? So minerals, you might choose the natural mineral drink, or you might choose mineral essentials, the red bottle liquid one. Essential fatty acids such as our EFA krill, which has 5 different essential fatty acids in there. And you would choose a multivitamin, whether this is your adult multivitamin, your adult multivitamin plus botanicals, or your essentials. So be on those 3 key products, and then you value add whatever your issues of weakness are. So get on your core nutrition, and then you top up if it's more joint or cardiovascular, then you add those products to support your health where those weaknesses or challenges may be. Okay, so let's have a look at our next product. We have our antioxidant. So what are you going to look for in an antioxidant? Number 1, you want a multi-ingredient antioxidant, and you want one that's multi-generational. That means contains our first, second, and third generation of antioxidants, and at the same time has a very high ORAC value, which stands for oxygen radical absorption capacity. All right. So the higher the value, the greater the effectiveness of an antioxidant would be. So what we're looking at here is we're looking at a number of different ingredients which all have a very good value of ORAC, but just imagine the synergy of all these ingredients when you combine them together. Now, what does an antioxidant do? Okay, so a very simple picture is there. You have an apple, You cut it in half, and the browning of the apple is due to the oxidization that's going on. Now, you can do this to your avocado. You know, you have your apple, your avocado, you get a lemon, for example, and you dribble lemon over one half of the apple, over one half of the avocado, and not on the other half. You will see the difference in the rate of oxidization. The one with the lemon juice, because lemon we know is a very good antioxidant, slows down the rate of oxidation of the apple. Now, what's happening within our body is, this is happening in your body as you age. Our body is oxidizing. Now, just the fact that you're living, breathing, and ingesting and breathing oxygen in and out is a process of oxidization. So we're creating free radicals all the time. But we hope that our body is able to also, what it does, it manufactures its own antioxidants. But here's the kicker, everyone. Stay tuned. The kicker is you're only going to produce enough of your own antioxidants if you consume fruit and vegetables and supplements that provide you the raw ingredients for your body to make them. So glutathione and SOD, superoxide dismutate, your body needs selenium, it needs chromium, it needs vitamin A and C. It needs all these things for your body to make its own antioxidants. And unfortunately, we don't find enough of those antioxidants in our foods anymore. So I just roll my eyes when people say, I'm on a really good diet and I don't need to supplement. I say, well, sorry. If you're living on a pristine island with organic produce, with no chemicals and insecticides and pesticides, and doing a wonderful organic job in fertilization, composting, then you may not need to. But hey, who's living that idealized life? I'm sorry, no one really is. So this is why we do need to top up. And now the number one cause is just the fact that we're living, breathing, we produce free radicals. The fact that we're also exposed to UV light, the fact that we're exposed to cigarette smoke, chemicals, pollution, we ingest food which has sugars and preservatives and insecticides and pesticides, all these things cause free radical damage, right? So what happens, these free radicals are basically unstable oxygen molecules, right? And when you have an unstable oxygen molecule, it actually is contributing to the corrosion and the erosion and the degradation of your body. So what an antioxidant does, so anti means against. Oxidant means it's against oxidization. So it's helping to stop the oxidization, the breakdown, and the degeneration of your cells. So the antioxidant actually is very generous and donates an electron to the free radical. So the free radical is your baddie over here. The antioxidant is a goodie. It donates a free radical and neutralizes the free radical. And so it stops its activity, all right? So it stops it in its track and causes no more degenerative changes. So given that we're always exposed to chemicals and toxins and we're living and breathing, there's always an ongoing process of free radical damage. So we do need to, on a daily basis, top up. Eat as well as you can, but do top up with an antioxidant. Now, let's explore what's in our antioxidant. We have in this combination, I differentiated them in the three colors there. So our first generation of antioxidants is the ones in yellow. So the beta-carotene, which is a natural form of vitamin A, vitamin C, vitamin E. Our second generation of antioxidants, which are more potent, more powerful, is your grapeseed extract and your white pine. And your third generation of antioxidants, again more powerful, is from your turmeric and ginkgo biloba. So let's touch on each of them. Okay, so beta-carotene. So beta-carotene is the natural form of vitamin A. And what's good about having beta-carotene as opposed to vitamin A or retinol is that our body will only convert the beta-carotene into vitamin A as required. So if someone was taking a high dose vitamin A for, you'd have to be taking 1,000 units a day for a long, long period in time to get any toxic levels, because vitamin A is a fat-soluble vitamin, unlike vitamin C, which is water-soluble, so it flushes out of your body. Vitamin A, vitamin E, fat-soluble, actually store in your body. So if someone takes excessive doses of vitamin A, it can accumulate in their body, and that's what you don't want. So the benefit of having beta-carotene is that it actually is a natural form of vitamin A. So your body will only convert it as required, the amount that it needs. Vitamin A is so important for all your mucous membranes, particularly like your lungs and your gastrointestinal tract, but also your sinuses and so forth. So it helps nourish keep them lubricated, keep them moist, and keep them free of invasion of bacteria and so forth. Your skin needs vitamin A, that's a given. Vitamin A in the form of beta-carotene supports your immune system. We know beta-carotene is so important for eye health. So vision, lubrication, age-related macular degeneration, that's your AMD. So we want, something like eye health and everything to help in that regard. We have also the antioxidant powerful benefits of beta-carotene. Vitamin A from beta-carotene supports the cardiovascular system, as well as supporting cognition by slowing down cognitive decline. So that gives you a little snapshot of what beta-carotene is all about. Let's have a quick look at vitamin C, and I'm sure you're all familiar with vitamin C. Now, vitamin C comes in many, many different forms. Now, the type of vitamin C in our antioxidant from Modere is the calcium ascorbate dihydrate. And why this as opposed to ascorbic acid? Because it's actually a buffered form. So it's less acidic on the body and is not going to create any gastrointestinal irritation. So this is a buffered, more alkaline form of vitamin C. So it's gentler on the body. It's well tolerated by the gut. We know vitamin C is helpful as an anti-cancer protocol, immunoprotective for colds and infections, particularly the suppurative complaints. Someone who's prone to boils and stars and abscesses and things like that, vitamin C they definitely need. Vitamin C is great for your connective tissue and collagen. So this is a beautiful accompaniment to our liquid biocell collagen and our shape products, because that's going to enhance the benefit of the collagen. It supports your blood vessels, therefore supporting your cardiovascular system, supports your iron absorption. So as we said earlier, with your parsley, it's rich in iron, vitamin C. This also, vitamin C, helps the absorption of iron. And of course, vitamin C is well known for its detoxification benefits. So our third vitamin in this preparation is vitamin E in the form of D-alpha tocopherol acid succinate. And this has a higher bioavailability than synthetic vitamin E. And vitamin E, we know, supports cell membranes strengthening and integrity. It helps the immune system, reduces the risk of certain diseases. It's an antioxidant in its own right, fighting the oxidative stress by stopping the free radical production, increases the hydration of the skin, reducing appearance of wrinkles. So again, nice complement to your liquid biocell. Vitamin E has anti-inflammatory properties. It promotes healing. It acts as a natural barrier against ultraviolet rays and toxins, so it's skin protective. It promotes hair growth and your hair appearance, and prevents the loss of nutritional value of the fatty acids. So that is your first generation of antioxidants, the vitamins. Let's look at now at grapeseed. So this is, yes, your grapes, and it's the seed. So it's grapeseed extract, and this is standardized to like 3.6 grams of proanthocyanins, or the oligomeric proanthocyanins. Now that's a big word, but a very powerful and potent antioxidant. Some of you might have known that in the form of picogenol. But grape seeds are rich in antioxidants, including the phenolic acids, the anthocyanins, the flavonoids, the oligomeric proanthocyanins, the complexes. So we know about cancer prevention with antioxidants. The polyphenols reduce pain and swelling and inflammation. And it has both an inflammatory and an antioxidant role, does our grapeseed. And so therefore it's suggested that it can reduce the onset of neurodegenerative diseases like Alzheimer's and dementia. From a cardiovascular perspective, reducing blood pressure, improving blood flow, reducing the bad cholesterol, so the low density lipids. So we want that less, and the HDLs, the good ones, up. This grapeseed has shown great benefits supporting immune function, inhibits a variety of microbes and offering protection against antibiotic resistant bacterial strains. So that's great because that's becoming more prolific. Will also fight against foodborne bacterial infections and fungal infections like Candida. The grapeseed, because it has a lot of vitamin C content there, like vitamin C in its own right, does support collagen health and connective tissue and your bone health too. So it has an anti-inflammatory role with osteoarthritis and rheumatoid arthritis. Go this way, and let's now talk about our white pine bark. And there's a lot of really interesting history about when the French were exploring and landed up in what's now known as Canada, and they were all vitamin C deficient and suffering with scurvy. The native Indians gave them white pine bark and cured them of their scurvy. And so there's been a lot of research around the benefits of white pine bark. So it's a great source of vitamin C. Contains a number of different phytochemicals and natural plant compounds. And the hero of the group, like with the grapeseed, is again the proanthocyanins. So you're getting a double dose of the proanthocyanins here. Very, very powerful antioxidants, as I say, more powerful than vitamin C and E, and lots of other benefits. So obviously, antioxidant scavenging free radicals, it's anti-inflammatory, and it's known to reduce the pro-inflammatory cytokines that are responsible for chronic inflammation. So these cytokines contribute to ongoing relentless inflammation. So it's great to have something like the proanthocyanins to be able to slow that down. The benefit of the white pine for the cardiovascular system, improving blood flow, also beneficial in any cardiovascular, Raynaud's disease, but ED is erectile dysfunction, and there's suggestion that that's due to poor blood flow. So it's going to help with blood pressure as well. White pine supports improved blood sugar management, immune support, boosting brain function, and is skin protective and protection from the harmful UVB rays as well. Okay, so let's now move on to our third generation of antioxidants. I'm sure everyone's heard of turmeric, is very popular. Kirkman Longer concentrated extract to provide 540 milligrams, standardized to 10.8 milligrams of the curcuminoid. So that's the active ingredient. So we all know it as a spice. It gives curry-rich yellow flavor. If you've ever had Indian or Asian meals, you'll certainly be familiar with turmeric there. It's been used in India for centuries as a spice and also as a medicinal herb. And so we know the benefit of the curcuminoid. That's the main ingredient in turmeric. Powerful anti-inflammatory. So sometimes you'll see it available on its own, promoting its benefits for, say, arthritis. And it does, in fact, do that. But we also see that some studies have been shown to be as effective as some other anti-inflammatory drugs. Well, you know, at the end of the day, would you rather be on a drug which potentially has side effects, or a natural, you know, let food be a medicine type deal of turmeric and manage your inflammation, and obviously without the side effects? So very powerful anti-inflammatory and antioxidant, neutralizing the free radicals. It's cancer protective. It blocks the NF-κB, which is a molecule that travels into the nucleus of cells and turns on genes, what we call the telomeres, related to inflammation. So when we're living a good, healthy lifestyle and taking our supplements and eating well, these little telomeres on the end of our chromosomes either stay switched on or switched off, depending on what their role is, to support and optimize our health and well-being. When we have too many trans fats and chemicals and toxins and a crappy diet, these get switched on. And so you're more likely to express the negative side of your genetic inherited disposition. So that's why it's so important. We need to, you know, live well, eat well, rest well, connect well to maximize our ongoing health and well-being. Some of the other anti-inflammatory benefits at a joint level, the OA and RA gout bursitis, certainly there's lots of clinical evidence there. From a central nervous system perspective, curcumin boosts the levels of the brain hormone, BDNF, which we know that our logic does as well. It increases the growth of new neurons and fights various neurodegenerative diseases in the brain. And it can cross the blood-brain barrier. And so there's been shown in some cases improvements in pathological processes of Alzheimer's disease. So the fact that it supports BDNF is an amazing attribute to curcumin. Cardiovascular-wise, we know that it can help in cardiac disease. So that's turmeric. You know, use it as a spice, but use it as this antioxidant, so you know you're getting minimum your 10.8 milligrams per tablet as well. And the final ingredient is ginkgo biloba. And again, look at the history behind this one. So this is well known in Asia. It's a ginkgo plant, maidenhair, beautiful looking tree, and standardized to the ginkgo flavonoglycosides, 2.4 milligrams, and the ginkgo glides, and bilobidide, 600 micrograms. So it's native to Asia, thousands of years of use. and as a traditional medicine. So it's a very safe ingredient. It contains potent antioxidants, fighting the damaging effects of free radicals. So you'll see the theme that most of these ingredients are both anti-inflammatory and antioxidant. So the benefits there for arthritis, irritable bowel disease, cancer, heart disease, strokes. From a cardiovascular perspective, it increases blood flow by dilating blood vessels. And so there's the application and treatment in eye health, where the retinal artery is being compromised and there's poor blood flow. So it can help that, again, in erectile dysfunction. Some migraines, some theories about migraines is that it's spasming and constriction of the blood vessels in the brain. So something that can open up the blood vessels would be a good thing. So there's been some clinical evidence for the benefit of migraines. Anti-inflammatory, whether that's, say, at a respiratory level, that can be very helpful. And again, just as I said before, with if you run out of your immune health and you've got your anti-inflammatory there, that's great. But if you run out of that and you've got your antioxidant, you can take this one as a higher dose to deal with your cough and cold. For your respiratory infection, you have an acute episode of gout, you can take this as well, along with other combinations. Some good evidence about how it improves cognitive function, anxiety, and depression as well. So, just, explore the benefits of this. And so what happens, each one of those ingredients is almost a hero product in itself, isn't it? You can see how many different effects and benefits it does. So what happens when you combine all these 7 ingredients together? Well, you've got a very efficient antioxidant, and even a more efficient one with the antioxidant sustained release. So we just summarize a few things where you might find this helpful for. So this could form one of your daily supplemental protocols just to fight the ravages of free radical damage. But those who certainly need support, antioxidant support, because they've got some chronic disease going on, this is absolutely key. We've seen how good it's with as an anti-inflammatory product, say with joints, tendons, muscles, and ligaments in all your types of arthritis, whether it's gout arthritis, osteo, or rheumatoid. Any inflammation of mucous membranes, whether it's your cold, your laryngitis, pharyngitis, bronchitis, pneumonias, it can help there. It's a very powerful detoxification product. It's going to support tone elasticity. Like if I go back to when I was using our protocol for our weight loss, I had 50-year-olds drop 50 kilos with no saggy skin before we even had the benefit of our collagen product. And I felt it was this product because of the OPCs in grapeseed and pie bark to help support skin tone. So this is really important for your collagen. Your immune health is there, whether it's also your cough and cold and your upper urinary tract infections or your upper respiratory tract infections, and whether it's for chronic immune issues or your autoimmune issues too. It could be like your hay fevers, your allergic type conditions, or the rheumatoid arthritis, or your Sjogren's, or psoriasis as well, which is known to be autoimmune. But even they're saying hypertension, it can be classified as autoimmune disease. Specifically blood vessel wise, when we combine all the benefits of vitamin C and turmeric and all that, you can see how it's going to help your blood vessel integrity. So it strengthens your blood vessels. So what does that mean for varicose veins and hemorrhoids? Absolutely. So this can help in that regard. And circulation. And if we look at the CNS and your brain, neurodegenerative diseases, cognition, depression, anxiety. So this is has a veritable range of benefits and certainly has a broad application. So I would certainly be having this as one of your key products. You have your core nutritional ones, like as I mentioned, your vitamins, your minerals, and your essential fatty acids. But you may have this as an ongoing one, or it may be one that you rotate periodically. I know some people take 3 or 4 key ones, and they might rotate their green key, their probiotic, their antioxidant, and so forth every month. So that's definitely an option and possibility. Now, I just want to finish off with a little bit about inflammation, because we saw what these 2 products can do from an anti-inflammatory capacity. And so what I want to demonstrate is what the role of inflammation does in our body. Now, it is the body's first defense against infection. And under normal circumstances, inflammation resolves quickly. But the question is, what's normal today? Our exposure to chemicals, environmental toxins, obesogens, free radicals, consumption of nutrient-deficient foods and pro-inflammatory fluids can increase the risk of heart disease, cancer, diabetes, allergies, autoimmune disease, Alzheimer's, and a host of other diseases. So this is what inflammation is about. So I'm just going to touch on causes, how it expresses, the supplements we can touch on, and food and lifestyle really quickly. Now, this goes back to February 2004. You know, the front page of Time suggested that inflammation is the silent killer. Chronic inflammation may be the engine that drives many of the most feared illnesses. This concept is so intriguing because it suggests a new and possibly much simpler way of warding off disease instead of different single inflammation reducing remedy that could prevent all. So, you know, seriously, we have at our disposal some wonderful, powerful, effective anti-inflammatories. And if you can stop inflammation at its commencement, you, I believe, will prevent the cascade of negative chronic inflammation. And you'll see that demonstrated in the picture in a moment. So there's books being written about the silent inflammation being the killer in our world today. So this is an example. If you get a splinter, this is the stimulus is the splinter, your immune helper cells and your white blood cells and your lymphocytes and your platelets all surge on this point of assault or injury. So your body, your immune system is immobilized. And what you have there, you can see all the characters of inflammation: heat, redness, swelling, pain, and loss of function. And that's what happens with acute inflammation. But your body, a robust system, is able to effectively mobilize its resources and put it at rest. All right? That is what simple inflammation is. But if your resources are poor, if you have a crap diet, if you don't do the right things, if you're not topping up, this inflammation can become chronic. So there's an ongoing inflammatory process. Your body is trying, it's trying to defend itself, but it just doesn't have the vitamins, the minerals, all those ingredients to do the right things. So they're trying to do their job, and there's increased inflammation, which tends to percolate, it cascades. And so you get this ongoing cycle. So that's the difference. So simple inflammation resolves, chronic inflammation continues. Now, from a homeopathic perspective, this is what I see, that you've got your acute inflammation. That should resolve. But if it doesn't, it leads to chronic inflammation. Now, when chronic inflammation goes for so long, you start getting fibrosis. So what happens is your connective tissue starts becoming fibrosed. The next stage is it becomes sclerosed, which is a hardening. So fibrosis is fibrous, sclerosis is hardening, stenosis, it starts narrowing. The next stage is ulceration, and the final stage of disease basically is necrosis. So that's when you're getting ulceration and cellular death. So the thing is, if you allow chronic inflammation to proceed without intervention over time, in some cases this is quick, in some cases it takes 10, 20, 30, 50 years to happen, this is the progressive cascade of degenerative changes that happens in your body. And we, I believe, with our products, can intervene and stop that negative ongoing degenerative changes. Now, you might ask yourself, well, where does all this chronic inflammation come from? So, when I was putting this together, I looked at a number of different things, and I'm sure you'll identify with some of these things. And we'll race around the clock here, start at midday. So heavy metals. So arsenic, cadmium, mercury, lead are some of the chronic toxic metals which will contribute to inflammatory disease. And we know lead contributes to, those kids historically. That's why we now have unleaded petrol, because the kids who lived near the freeways had lower cognitive function. They were less intelligent. So that's one of the main reasons why we have unleaded petrol now. So these heavy metals cause chronic inflammation. Air pollution contributes to inflammation. Microbes, your viruses, bacteria, fungi, protozoa, parasites, which disturb your gut microbiota, will contribute to inflammation. Repetitive activity, and this could be in a sports person or a person in a factory doing repetitive movement. So that also can, just that ongoing movement, RSI, someone who's using their wrist a lot, could be even a massage therapist, using their hands a lot in whatever industry. So repetitive inflammation or repetitive activity can cause inflammation. Some people have the unfortunate tendency to inherit genetic dispositions, which can predispose them to inflammation, but also you can acquire things as well and have the metabolic diseases. Free radical damage, so external exposure, internal byproducts of metabolism. So the external exposure could be UV, B rays as well. Stress is also an inflammatory issue. So if you're ongoingly stressing yourself, you're pumping out all this cortisol. Cortisol degrades your collagen. You look at someone who's a worrywart, they look older than someone who's more carefree because they've been pumping out cortisol for years and they've got all these worry lines, okay? That's not good. So someone who is not adapting and not resolving the stresses in life, that can contribute to chronic inflammation as well. Leaky gut syndrome, so when the lumen in the bowel wall become greater because of inflammatory changes and you get degradation, you have all these particles that are all these molecules in your gut that should flow through your gut, but they start getting absorbed. And when they get absorbed, they go through your circulation, land somewhere and cause problems. So lifestyle factors can contribute to chronic inflammation. Excessive alcohol, smoking, drugs, both prescribed and recreational. Weight gain and obesity. Obesity is an inflammatory condition, all right? So it's actually, being obese is a disease. And there are so many comorbidities associated with obesity, like heart disease, diabetes, cancer, and so forth. So that needs to be treated. Nutritional deficiencies, inadequate production of resolution mediators. So when you're deficient in vitamins and vitamin D, particularly minerals, essential fatty acids, you're not providing your body with the resources to stop the inflammatory process, to halt the free radical, but also the inflammatory processes. Food and things that you ingest, a too acidic diet, full of preservatives, full of additives, full of sugars, nitrates, gluten, insecticides, pesticides, herbicides. All these things contribute to inflammation. We're also exposed to environmental toxins. Your mattress has flame retardants in it, and you absorb that. Our phthalates in our plastic containers and so forth. So you have to have BPA-free plastic bottles. And thank goodness Modere has BPA-free containers, not just for their pills, but for their shampoos as well. Avoid solvents, avoid the parabens and so forth. So, you need to do your best to avoid all these things, but it's also impossible to avoid all these things all the time. That's why you need to have your antioxidant and your natural anti-inflammatory. So what happens when the inflammation starts? So we looked at, there are all the things that contribute to inflammation, so it causes inflammation. Now let's look out at what some of those inflammatory conditions are. And I think this is basically our last slide. So when you have chronic inflammation, and so, look at the people around you in your world. Someone gets migraines, someone gets stomach ulcers, someone gets Crohn's disease, someone gets cancer, someone else gets diabetes. What determines that is your lifestyle and also your genetic predisposition. So in this clock that we have here, the expression depends on your unique combination of your genome, okay? So if there is a bit of a cardiovascular weakness and you've had all these trans fats and you have all these high fatty foods, you're more likely to express a cardiovascular disease, all right? That could be atherosclerosis, it could be stroke, it could be heart failure, cardiomyopathy, and so forth. If it's more a metabolic problem, like diabetic, it's getting overweight, and you have metabolic syndrome like insulin resistance, it might be more the atherosclerosis, cardiomyopathy, renal failure, retinopathy, sepsis, and neuropathies. So these are all diabetic complications that, you start with putting on a bit of weight, elevated blood sugar. If you don't listen, like diabetes, it amazes me when people are diagnosed as diabetic and they're automatically put on their oral hypoglycemics, metformin, Diabix or whatever, or they go on insulin. Prior to wouldn't it be a good idea to drop your 5, 10, 20, 30 or 50 kilos? Because diabetes type 2 is a lifestyle disease. No one who has diabetes type 2 should be on insulin or oral hypoglycemics because it is reversible. And we see that time and time again. Chronic inflammation, that's irritable bowel disease, chronic obstructive pulmonary disease, autoimmune disease, rheumatoid arthritis, psoriasis, chronic pancreatitis, COPD and COPD. I forgot what that means. Anyway, skip that. When we see chronic inflammation expressing at the level of bones and muscles and skeletal disease, you're going to get your osteoporosis, so a loss of bone density. You're going to get the osteoarthritis and degenerative joint disease as well. Even your muscular dystrophies fit into that category. Cancer, unresolved inflammation, and if there's, your cancer gene and you do all the wrong things and you're exposed to all these chemical toxins, you're more likely to express a cancer profile. And we know increasing abdominal girth increases your risk not just to gastrointestinal cancer, bowel cancer, but to all cancers: prostate cancer, lung cancer, breast cancer. The metabolic disorders include your fatty liver. A lot of people have non-alcoholic fatty liver. So it's not because they've been drinking too much and got cirrhosis and fatty liver. It's just that they're predisposed to that. They're overweight. They've got blood pressure. They've got raised blood sugar level and their fatty liver. And these are reversible. I've lost count of the number of people that I've seen with fatty livers just disappear. Their liver function goes back to normal, as does the type 2. And then we end up with the neurological diseases like the Alzheimer's, the Parkinson's, and dementia. So this is what can happen with chronic inflammation. And, I hope this scares you a little bit, all right? I just don't want to paint a really nice picture. But if you take the correct measures, right, and you look after yourself, you have a good lifestyle, good diet, you take the best combination of supplements you can do, including our antioxidants and anti-inflammatory, you categorically can reduce your risk of expressing these chronic types of diseases. So hopefully that gives you a picture of our two products, our anti-inflammatory and our antioxidant, as well as what free radicals and antioxidants they do, but also the role of inflammation in our bodies and how we can actively fight it to have a more healthy and fulfilling life and lifestyle. So that's basically it for me. We just bring up that one there at the end. Get onto your core products, your core nutritions or your unique combination that serves you well, and you will add these couple of products into your protocol. Hopefully you have now a bigger and better and more comprehensive understanding of the power of these two products and see that they have a greater role in your life and also the people that you connect with. So that's it from me. Over to you, Betty.
Thank you.